COVID is not going to go away. It's going to be endemic the world over. It's not going to be able to be driven back into the wild. So that's for sure. But that's in the long term and at equilibrium. The whole point of trying to move towards endemicity, however, is to protect vulnerable groups in the population against serious disease or deaths. And what Hong Kong, uniquely amongst places with privileged access to vaccines, has not yet been able to do is to protect those most vulnerable. And that's why you're already seeing some fairly large, by Hong Kong standards, death numbers, even though we are still only a few weeks into this fifth wave. And secondly, why our hospitals are actually overwhelmed. And that's, of course, disappointing that Hong Kong has not been able to vaccinate those most vulnerable age groups up until now. But that's really water under the bridge. If we had more time, I'd, of course, be happy to go over some of the reasons.
So, as we've been reporting, Hong Kong is facing tighter restrictions, Gabriel, but I believe that you are advocating an even harsher line, and that is, of course, putting the entire city under lockdown. So how much harsher in terms of restrictions would you be pushing for, and how likely do you think that is? And I guess the most important question of all is, how effective do you think it would be?
So essentially in Hong Kong right now, what we need to do is to protect the integrity of the health system so that for those people who get seriously sick with this particular wave, they would have adequate health care provided to them. The health system in Hong Kong currently is under enormous stress. So what we need to do is to be able to slow down this epidemic growth. And the only way you can slow it down now is really to go and reduce further the people from mixing with each other and from moving about in the city. So whether you call that a lockdown or whether you call that enhanced or stepped up public health and social measures, I don't really mind. The jargon is not the important thing, but what we need to do desperately is to make sure that we protect the integrity of the hospital system such that we prevent people from further deteriorating if they really need help in the hospitals. And that's what we need to do.